The center is also grateful for the support from the SAMHSA for evidence-based practices and for Center of Excellence activities. Kimberly Nelson from SAMHSA is here today with us. Kimberly is the Region 7 Administrator for SAMHSA, an area which covers Missouri and 6 other Midwest states. Kim, if you'd like to make an opening remark as well. Thank you.
Absolutely. So you can hear me probably, but not see me yet. Is that right?
Yeah.
Okay, I'm going to, there we go. There's the camera. Oh, here I am. All right, start my video. Okay, now you can hear me and see me, yes?
Yes.
All right, great. Thank you. All right, I just want to reduce my view here. Oops, no, that didn't work. Let's see. All right, exit full screen. All right. So thank you for having me, inviting me. I am so excited about what's happening here. So I am Kim Nelson, and I think hopefully most of you know SAMHSA is the Substance Abuse and Mental Health Services Administration. We are part of the U.S. Department of Health and Human Services, like other agencies such as the CDC, CMS, you know, folks that you hear a lot from these days. We at SAMHSA are the only agency in federal government that's dedicated solely to mental and substance use disorders. And I'm your regional administrator. I'm your regional representative. Hopefully some of you know me. I live in Lawrence, Kansas, and I serve the states of Kansas, Iowa, Nebraska, and Missouri. So when we are able to, I do spend a lot of time in St. Louis and have been to places for people and know Joe Yancey and probably several others of you well. So just a few things to think about here. Our most recent data from the National Survey on Drug Use and Health 2019, so pre-pandemic, have to kind of qualify that these days. 61.2 million Americans had a mental illness or substance use disorder. That data for this last year was an increase of almost 6% over the 2018 data. And that increase was composed entirely of increases in mental illness. Again, that's pre-pandemic. SAMHSA believes in the use of evidence-based practices. If you haven't been out to our website and seen our relatively new evidence-based practice resource center, I would encourage you to do that. It's easy to find. So SAMHSA's website is SAMHSA, SAMHSA.gov. And then once you're there, you can type in EBP or Evidence-Based Practice Resource Center, and then that'll take you to that part of our website. And this center really aims to provide communities, clinicians, policymakers, just the field in general of behavioral health, which for when we say that, it really means mental health and substance use disorders combined, aims to provide you information and tools that you need in order to incorporate evidence-based practices into whatever setting you are in. This resource center is really easy to search. It's a huge improvement over what we've had in the past. Again, so if you haven't been out there, I would encourage you to. It's dynamic. It's able to be more responsive to emerging issues. Really allows SAMHSA to more quickly develop and disseminate expert consensus information. The way that we do a lot of that is in what's called these guidebooks. And so you can find guidebooks that, you'll see the table of contents, very easy to navigate. They kind of give an overview of the issue, what the current research tells us, some examples of effective strategies, guidance on how to implement those evidence-based practices in your setting, and then resources. This approach, coupled with, again, over the last several years, what we have kind of moved our technical assistance away from a national model into a regionally based, locally based model of technical assistance, which is available for everyone. All right, so, and then, SAMHSA, of course, supports a recovery-oriented, I know we're going to talk today about the recovery-oriented system. We're calling that recovery-oriented system of care kind of ecosystem these days. SAMHSA obviously supports recovery. We kind of, developed, with many stakeholders, I'm sure you know, this definition of recovery, working definition, a process of change through which people improve their health, their wellness, live a self-directed life, strive to reach their full potential. We support that through a variety of funding resources. Starting in 2004, actually, Missourians know this because of your incredible investment in what was then called the Access to Recovery, or ATR funding. Missouri had 15 years, just solid funding of that resource, which has led to a very active recovery supports, coalitions, and community in Missouri. So this ecosystem, of course, consists of, a person's place and life in the community, which might or might not include treatment, rehabilitation, might include support services, peer support, but definitely includes housing, social support, belonging, all of the things that everyone needs. So SAMHSA supports, that framework. Lastly, I'll just say, we can't talk about behavioral health in St. Louis without acknowledging the huge disparities that continue to persist, especially in the African American community as it relates to opioid overdose deaths. St. Louis is working to address this issue, I know, and I know that you all will be part of that. Just, SAMHSA has what's called an Office of Behavioral Health Equity. Recently, that office produced a publication called The Opioids Crisis and Black African American Population, an Urgent Issue. St. Louis is featured in that publication under community strategies to address this, specifically focusing on engaging the faith community, just one example. I am thrilled to be here and to hear that St. Louis is starting this Center of Excellence, and I just stand ready to help you in any way that I can. Hope you have a great day. Thank you.